A breast lump is extremely common. 1 in 3 women will notice one at least once in their lifetime. Most are harmless, but the risk rises significantly with age. After 50, about 4 out of 10 breast lumps can be cancer. That risk is high. That's why I'll tell you the top 5 causes of breast lumps. We'll pay attention to their treatment and prognosis. The most common cause is fibroadenomas. Usually, they appear in young women before the age of 35. Even teenagers can have them. Fibroadenomas feel smooth, firm, and mobile, like a marble gliding under your fingers. Usually painless, but in around 10% of cases, they can be slightly painful to touch, especially just before periods. They are benign, not cancerous. Simple fibroadenomas almost never turn cancerous. Complex fibroadenomas can increase breast cancer risk about 2 times, but the risk remains low. Usually, watchful waiting is enough. Just observation. Most fibroadenomas grow to about 1 to 3 centimeters. On ultrasound, they have clear borders, wider rather than taller, and a simple uniform interior structure. The lymph nodes under the arm shouldn't be enlarged or suspicious. Fibroadenomas grow because female hormones, estrogen and progesterone, sometimes overstimulate breast tissue. They grow slowly over years or stay stable. If a fibroadenoma becomes uncomfortable, grows fast, or shows suspicious changes, a biopsy or removal may be necessary. Surgery usually cures it completely, without long-term problems. The second most common breast lump is cysts. These are fluid-filled sacs, typically appearing in women aged 35 to 50. Round or oval, smooth and soft. They can be tender and painful before periods. They might fluctuate with menstrual cycles. Hormonal swings block tiny ducts, trapping fluid inside. Ultrasound easily confirms cysts. Aspiration can relieve symptoms, but most cysts resolve spontaneously. Surgery is rare, only for cysts that refill or look suspicious. The third cause is breast cancer. Any woman has about a 13% lifetime risk. After 50, that risk significantly increases. Cancerous lumps are firm, irregular, non-mobile, and usually painless. They don't change with menstrual cycles. Risk increases with age, family history, and genetic mutations like BRCA1 and BRCA2. Early detection saves lives. Nearly 90% survive 5 years or more if detected early. A cancer lump stays steady through cycles, stubbornly painless, sometimes causing skin puckering like an orange peel, nipple inversion, or bloody fluid leaking. Swollen nodes in the armpit heighten suspicion. Annual mammography after 40 is strongly recommended, especially for early detection before lumps become touchable. Women with family history or genetic mutations should start screening even earlier, as young as 25 to 30, combining MRI and mammogram yearly. Early breast cancer prognosis is excellent. Carcinoma in situ or stage 1 cancer have very high cure rates. 8 out of 10 early cancers respond well to hormone therapy. Even stage 2 cancers have an 80% chance of remaining cancer-free for 10 years or more. However, late stages have worse outcomes. Stage 4 breast cancer 5-year survival is around 32%. Clearly, earliest detection is key. The fourth common cause is mastitis. It's a painful red swollen lump, usually occurring during breastfeeding, often with fever and flu-like symptoms. The lump feels warm and hard, caused by milk stasis and bacterial infections. Antibiotics and sometimes drainage are needed. Prognosis is excellent. Finally, fat necrosis, caused by injury like a blow to the chest, previous surgery, or even tight seatbelt pressure. It triggers sterile inflammation, appearing in 1 to 2% of breast lumps. The lump often feels firm, sometimes rock hard, occasionally tender. Bruising or dimpling of skin may appear later. Imaging typically reveals an oil cyst with smooth borders or coarse calcifications. Usually no biopsy is needed unless imaging looks suspicious. Fat necrosis needs only reassurance. Surgery is rarely required. It never becomes malignant, and the long-term outlook is perfect. Early detection is critical. Vigilance saves lives. So stay informed, stay alert, and prioritize your health.